First name Vinay, Vinay. Last name Goyal, Goyal.
Okay. Do you ever have Goyle mispronounced?
Oh yeah, Goyal. Goyal is how it should be. It's Goyal. I've gotten used to it. So I actually started pronouncing it Goyal.
Just whatever they want to call you.
Yeah.
All right. Well, I'll call you doctor. That'll be an easy thing to do there. So tell me about with one of the options that you have is bariatric surgery. So talk about first. I don't know why I'm starting with the bad part, but are there misconceptions about bariatric surgery?
Yes, absolutely. So bariatric surgery has grown like any other branch over the last 30, 40 years. Initially in 60s and 70s, the surgery was done open with big incisions, which was a problem in somebody who's already obese. And the recovery was not as smooth. Over the years, with the advent of laparoscopic surgery, minimally invasive surgery, things have gotten much smoother. Recovery is much quicker. And so overall bariatric surgery has become much safer, but the past lingers on, and that has led to misconceptions about risk of complications from the surgery. Other thing people have misconceptions about is that this is going to be get it done and fix it forever kind of surgery, which it is not. Because you have to combine the surgery with lifestyle changes to get the long-term benefit, and that's another misconception that people often come with, thinking that they'll have this surgery and then they can go and do whatever they were doing before. So those are the two main things that.
Yeah, I know, and a friend of mine just had bariatric surgery. One of the things, you can't drink carbonated drinks, is that correct?
That's right.
Okay.
That's right. The sodas are one of the biggest enemies of weight loss because they have pure calories, no nutritional values, and on top of that, if you have had a bariatric surgery where the size of the stomach is reduced, then the carbonation, the release of gases can cause reflux and other problems. So from both aspects, it's not a good idea to be on sodas and carbonated drinks after this surgery.
You mentioned, Doctor, the laparoscopic surgery and how that kind of changed things. Technology has improved the way you do medicine these days, hasn't it?
Yes. So like I said, in early 2000s, we started doing these surgeries laparoscopically, and now in last 5 to 10 years now, we have gone to the next step where we use robotic surgery in performing these procedures, which has resulted in quicker recovery time and much smoother recovery from the surgery.
Why do you do what you do?
So that's a great question, because I have often asked that to myself, and the answer is immediately when you see these patients after surgery in the clinic, that's when you really get the personal stories. Like, yeah, as a doctor, I see the numbers changing, their weight getting better, their medical problems going away, they getting away, they stopping their diabetes and blood pressure medications. But when the patients come back with their stories like their pant size is reduced, they could shop in regular clothing stores instead of having to go to special big size clothing stores. They can sit with their grandkids in for example, a Six Flag ride, or they could bend down and tie their own shoes. All those things, having never been in that situation, I can't even imagine how that affects their day-to-day life. And that's the most gratifying part when you hear those stories, that yes, I'm doing something that is changing lives.
So yeah, you have a lot of really good success stories that have
Yes.
built up. What's the most dramatic that you can recall that you were directly involved in, Doctor, as far as weight loss?
So that was one of my earliest patients who was a dad who recently became a dad and wanted to be healthy for his kid because his medical problems were mounting as his weight was going up, and he saw that he will not be around for long to see his son growing up. So he came to us wanting to lose weight, wanting to change his lifestyle, and we worked with him and then did a bariatric surgery. And I saw the transformation when he saw the results started to pour in the first few months. As he started to lose weight, I saw how dedicated he became with the weight loss, and that became his sole, I would say, obsession almost, that he became so oriented towards healthy eating and exercise that till this date I'm in contact with him, and he keeps on motivating me actually to eat healthy. He has gone to the point where I can't. When I look at myself, I think I should be, I should be doing what he's doing in terms of exercise and healthy. And his sole purpose was because he wanted to stay around for to see his kid growing up.
Well, you mentioned that as motivation. I would assume that the ones who have a motivation like that and have a personal reason, not just wanting to look better,
Yep.
they want to be better for their family or something else. That motivation helps, doesn't it?
Absolutely. So so that was one of the most important things we look in when the patient comes to us for the first visit. What is their driving force behind losing weight? If it's a number that they are chasing, it's probably not going to work that well, because none of the things that we do ever guarantee a particular number or a particular result. But we definitely guarantee that you will be healthier than what you started with. So in terms of getting rid of medical problems, coming off of medications, and overall living a healthy life and a longer life. So when they have a personal connection or a family based connection and they are invested in that and not just reaching a number or looking good, then we see the results. Obviously, they are much better when people are invested personally and they are looking out for their family members and want to do this for their family.
Do people need to be referred to you, or can they just come in and want to know more?
They can come in and talk to us. A lot of times it's dictated by the insurances. Sometimes the insurance, depending on what kind of insurance they have, they may have to ask the PCP to be referred, but a lot of insurances you can just self-refer to a bariatric surgeon and come and talk to us about what the options.
And a lot of yours is education. I mean, you need to educate them into just what we've been talking
Yes,
about. Right?
so like I said, the first visit is all education. In fact, even before they come and see us in our program, we have a online webinar, free online webinar, which gives links to the surgery, the nutrition, and the medical weight loss part. All of them are free, and they have to watch that first before they even come to see me, because that's like 1.5 hours of pure education that they can do at their own time with their family members at home. And then once they come with the background knowledge about what they're getting into, then it's much easier for me to explain things, and they have a much better grasp about 45 minutes to an hour time that they spend with us. They have a much better grasp of what things we are talking about.
Excellent, yeah. You like what you do?
Absolutely. Like I said, those personal stories are what drive me towards keep doing this. And also, I also like the technical aspect of these surgeries. Like I said, the technology has been a big player in improving the outcomes, and doing these surgeries through tiny 5 or 6 small incisions, which are like about a 1/2 inch to an inch in size. And doing that complex surgery through those small incisions is another aspect of this thing that interests me.
It's fascinating, yeah. All right. Thank you, Doctor.
Thank you.
That was great.